just the fact that the pandemic has spanned so much longer than I think a lot of us anticipated is really weighing on a lot of people.
It's been a long 2 years of collective bleh with rising mental health concerns. And while there also has been more awareness, so we're talking about it more, how have the supports been adapting?
There's definitely been an increase in need in mental health services, and that can be seen in the wait lists for practitioners. There's a shortage of therapists.
Simone Saunders is a therapist at DiveThru. It's an app that's main goal is making mental health learning tools more accessible, especially to a younger generation.
Maybe a little depressed. Honestly, same.
And for founder Sophie Gray, that increase in awareness has helped apps like hers grow.
3 years ago, I had to spend a lot of time convincing investors that this was a space that needed attention and needed dollars. These days, that's not the case at all, and people are getting more curious.
Former fitness influencer wanting to add that same awareness we have for physical health to mental health, reminding it's also about taking steps when you're doing well.
We should have learned these things in school, but we didn't. So learning about, what is a panic attack? What's happening in your body? Why is your heart rate going up? Why are you getting cold, but you're super hot at the same time?
Not as a replacement to therapy, but recognizing gaps in the system. It's an add-on or something while waiting for an appointment.
We're never going to answer everyone's mental health questions in a 2-minute news report, but what would you tell people who are going through a hard time right now?
I definitely would tell people that you're not alone. I think that it's fair to say that everyone has experienced mental health challenges in the last couple of years as a result of everything that's going on in the world to one degree or another.
A lot of the time, therapy as a whole just isn't accessible from a price point perspective or, again, availability. So sometimes we do see that, the DiveThru tool can be the only tool that's being used, but that's, more of a government problem. And, let's make therapy a part of our universal healthcare.
And Canada's Chief Medical Officer, Theresa Tam, tweeting out a reminder for self-care during these difficult health measures. And if you are in an immediate mental health crisis, there are a number of supports and crisis lines available. In Edmonton, Carly Robinson, City News.